Hi, I'm Dr. Victoria M.A. I'm a board certified plastic surgeon in Scottsdale, Arizona. I recently received a question about mesh that we use in breast surgery and how it is the same or different than mesh that we use in abdominal hernia surgery. It's a great question. So there are about three different main kinds that we can use in the human body. One of them is a permanent kind of mesh. That's typical for using in places that we don't want anything to dissolve or anything to go away or get too stretchy. We want it to maintain its strength. There is a mesh that is long lasting but incorporates into tissue over time, so it's not going to be there forever. And then there is a mesh that is made from a biologic material, so it's actually made from something like human cadaver skin or pig skin. They all have kind of different purposes and goals. So the mesh that we use in breast surgery, whether it be a breast augmentation or revision or reconstruction, looks like this. It's made from a material called P4HB. And so typically it holds up a breast implant and gives some extra support while everything heals into place. Now, this mesh will typically incorporate and resorb over the course of about 18 to 24 months. That is a long-lasting mesh. Now, the mesh that we use in abdominal hernia surgery is typically a permanent mesh. Think of it like a suture that has to be removed in the office because it won't dissolve on its own. Those mesh are more likely to get infected if there is any sort of contamination in the area. So if there is an intestinal injury, for instance, we typically will not use permanent mesh. Instead, we will use cadaver skin or pig skin mesh, so an acellular dermal matrix, as they're called, which are less likely to get infected in wounds that have contamination. So that is also the same kind of mesh that we sometimes use in breast reconstruction surgery. And so that is essentially the main difference between the mesh that we use in abdominal hernia surgery and that we use in breast surgery. Hopefully that answers your question. If you have any other comments, feel free to drop them below.